In March 2020, college student Gianna Schembari began a battle with an illness that came out of nowhere.
The most noticeable symptoms that happened that early were the significant weight gain, my mood swings. I just kind of started getting into like a really depressive state. I would get these headaches, I would get heart palpitations. Things just started getting worse very quickly.
Months of tests ruled out many possible causes, but yielded no clear diagnosis.
There were so many times that I would just cry in my room because I didn't feel well, and there was nothing that anybody can do at that moment to make me feel better.
Eventually, an MRI revealed a small benign tumor called a microadenoma located on Gianna's pituitary gland, an indication of Cushing disease, a rare disorder that affects only 10 to 15 people per million.
The endocrinologist had me take a medication that would supposedly shrink the tumor. It made me very, very sick. I could not function. I was in bed. We were just like, okay, maybe we need to go ask somebody else what they think.
Gianna and her family turned to neurosurgeon Dr. Michael McDermott, chief medical executive at Miami Neuroscience Institute.
He said, this is definitely Cushing's. And we were like, wait, we haven't had a diagnosis yet. He's like, let me be the first to tell you that this is Cushing's, and this is the treatment.
A multi-specialty team of physicians experienced in the treatment of pituitary tumors was assembled for Gianna's case, including Dr. Francisco PERNAS, an ear, nose, and throat surgeon, and neurosurgeon Dr. VITALY SIOMIN.
The pituitary gland is one of the most critical parts of the brain. And I would picture it as a command center that would produce the critical hormones and send them to the bloodstream. Cushing's disease is a condition when one of the hormones, which is called ACTH, is produced in excessive quantities.
When I met with the team of all of my different doctors, I just instantly felt like everything was going to be okay. They knew exactly what it was, and then they just had their plan as to the treatment.
The team approach is really important. Some neurosurgeons will do the surgery on their own. The difficulty becomes the nasal anatomy. We as ENTs are skilled at nasal anatomy. We're skilled at nasal endoscopes, so we're working essentially four-handed person working together.
The technology nowadays allows us to approach these tumors in a much less invasive way. We could put the scopes through the nostrils and navigate the scopes using what's called the image guidance technology. It is just like GPS that most people use for driving. We use the same technology for surgery that helps us to go directly to the tumor, open up very minimally, and resect the tumor using the endoscopic visualization.
It's been about 7 months since the surgery, and I feel amazing.
This is before surgery, and then there's this adenoma over here, and with the measurements, and now this is after surgery. It's all gone, and you have normal, pituitary gland tissue here.
Before the surgery, I had high blood pressure, anxiety, panic attacks, nausea, vomiting, all that stuff, and I was on about 5 medications. Since the surgery, I am not on one medication, and all of those symptoms are completely resolved.
Gianna is doing very well. I think her prognosis is probably going to be excellent.
They are the best doctors on earth. I feel like a whole new person. I basically got my life back, and I'm super, super happy.